It's time for It's Your Health on Good News 93.1. It's Your Health is presented by Boomers Executive Fitness and Physicians Quality Care on Pleasant Plains Extended in Jackson with your host, Dr. Peter Gardner and Dr. Clifford Gerard. And now, it's Your Health.
Health and fitness for our generation. Boomers Executive Fitness.
Good morning. Another Tuesday morning. The name of the show is It's Your Health, sponsored by Physicians Quality Care and Boomers. What this show is a general 30-minute call-in show. Basically, what we do is we encourage you to call in, just throw a medical question out there. My name is Peter Gardner. I am a family practice physician by training, and to my left, the esteemed Dr. Clifford Gerard, cardiologist. Now that apparently it's come to my knowledge that come to my attention that we are live streaming.
Yes.
So we have video. So
we do.
I guess the idea that you may have an entourage is kind of been exposed.
Here we are.
Yeah, it's they're probably wondering who those people were clapping, and you know.
Mm-hmm. Yeah, people would like to watch. They can actually watch the show. Go to our website, gracebroadcasting.com. Click the Facebook link,
okay,
and it'll take you right there, and you can see the video of the show streaming in real time. So if you're kind of wondering what Dr. Peter Gardner and Dr. Clifford Gerard looks like, then you can go there and find out.
Yeah, exactly. Try to contain your disappointment, I assure you. Let me give the call numbers. I'm sorry, 663-2939, 663-2939.
Back to our original number.
Correct,
yes.
Correct, the oldies but goodies.
Yes.
And what we do is we encourage you to call in, and if you have a medical question on your mind or a thought, give us a ring. Like I said, I'll do my very best to give you an answer, or as I often say, steer you in the right direction. And this is a particularly good time to ask a cardiac-related question. By that, you just don't get, family practice docs like me, we're all over the place, okay? But cardiologists with the history and the experience of Dr. Gerard, they are rare finds. And to be on the radio where they're actually not charging you anything, this is amazing. I mean, Dr. Gerard charges me tons just to talk to him. He's going to talk to you guys for free, so this is wonderful. Once again, 663-2939, 663-2939. We'd love to hear from you. Just while we're waiting on calls, just in case you're not familiar with Physicians Quality Care, we now have two locations. Our original 2075 Pleasant Plains Extended. In short, that is in the columns. Okay, you know where the columns are in Jackson. We're right behind the Quiznos, basically. That big freestanding building kind of looks modern. Always kind of busy. Come by and see us. We are open 7 a.m. to 11 p.m. every day. That means Saturday and Sunday as well. 7 a.m. to 11 p.m. every day. And now our second location, which has the exact same hours, 7 a.m. to 11 p.m. every day, is in Milan, 15463 South 1st Street. In short, where's that? That's a strip of land right between the Lowe's and the Walmart. You can't miss us on 45. It's right there, okay? We'd love to have you come by and see us. That clinic is starting to take off and do well, and we're very happy with that. Come by and be a part of our our medical family once again. Yep, I see it. I'm seeing video evidence that this show actually exists. I don't know if I really, I guess I'm going to have to like it. That's just going to be part of that. Once again, 663-2939, 663-2939. It's on a little bit of a lag that I can see.
Just a hair, yes.
I'm going to give it a little head nod. There.
Yeah, what, 3 seconds, 2 seconds,
every
something
bit
like
of
that.
it.
Yeah.
Okay, my hand's up. Every bit of 3 seconds. Okay. That's amazing. Wow, we've moved ahead technologically. I'm kind of happy about that. Dr. Gerard, you're covered up by a microphone quite strategically. That's very nice. Very good for you. Excellent. Do you have any comments today?
Well, I'm sure that's why that our host here is wearing this good-looking Grace Broadcasting T-shirt.
Yeah,
today.
that's right.
He has bumped up the attire just a tad. Yeah, now that he's visual. Very good. Very good. Excellent.
Yes.
Wow. Well, now we'll have to bring guests on.
That's
now
right.
That we have video.
Yes.
This makes it a little bit more enjoyable in that respect. Once again, 663-2939, 663-2939. In the world of medicine, I can tell you this. In particularly the Mylan Clinic, we have gotten significantly busier in literally the last 2 days. We're starting to see the very first eruption of what looks to be a pretty good GI flu bug. People are not coming up flu A or flu B positive, but literally yesterday I began to see it. Day before yesterday I began to see it, and last night probably 7 of my last 10 patients were all people coming in with a GI disorder.
Wow.
Yep.
All right, we do have a phone
All
call.
right, excellent.
Hey, good morning. You're on the air with the doctors.
Good morning. How are you?
How are you? Thank you for calling.
Thank you for taking my call.
Sure.
I have a breakout, and it's like great big whelp, and I've been to doctor after doctor, and nobody doesn't seem to be able to help me. They give me a cortisone shot or a steroid shot, and some kind of steroid or a pain pill, but they can't seem to find the root of what causes these things. When I go through a lot of stress, it doesn't seem to trigger. Maybe a couple of months afterwards, then I start having it, and it's continuous. And they've got me on 2 different medicines now, Doxepin and Simetron, but I just can't seem to clear my system and get rid of this. Is this something that you're familiar with that I might have to live with the rest of my life, or is there a new step that I can take, or is there something that I can do?
All right, dear. Now, what is your name?
My name is Lois.
Hey, Lois. This is Dr. Gardner. Hey, now tell me real quickly, when did the rash first start?
Well, when I turned 30,
Okay.
I had the first case of it. And it was just like I had never had it before. My mom said I had it one time when I was little.
Now, does it wax and wane by that? Does it come and go a little bit?
Yes.
Okay.
Yes.
Okay. Do you have periods where it completely goes away?
Yes.
Okay.
Yes, it'll go away for like a year.
Okay.
And I have no problem with it. And then all of a sudden, I'll have a couple of bumps, and then I just have months every day or every night. I'll wake up of a night, and I'm just completely in a frenzy with it.
And now, when you do have an eruption, how long does that last?
Well, it can last as long as 24 hours if I don't take something.
Okay.
It won't go away until I take something.
Now, what are you taking that causes it to go away?
What?
What are you taking that causes it to go away?
A little pill called Doxepin,
Okay.
and one that's called Simetron.
Okay. Okay.
And that will cause it to go away, but not completely until it just, runs its course through my body.
Sure.
And when it runs that course of months and months, sometimes I've had it just about every day for 2 years, and then just all of a sudden it's gone.
Now, let me ask you this. Did a doctor put you on the Doxepin for the rash?
Yes.
Okay. Okay. Well, here's how I would look at this, okay, from the outside in real quickly. Number one, you want to make sure it's not infectious. I'm sure somebody's drawn blood on you and looked at all that kind of stuff,
Oh,
correct?
yes, they've done that. They've even done food allergy tests, and they
Correct.
couldn't find any cause for it.
Correct. And that would all make sense. I guess I would look at this. The upside is it seems to go away fairly quickly. Let me just give you some inside doctor information here. We rarely figure out what causes most rashes, okay? We like to act like we do, but we rarely do. And I've been doing this 20 years, and I can just tell you. I look at it a little bit more than the average doc, simply just because I see a little bit fewer more patients than the average doc. But docs don't get overly burdened with finding the specific diagnosis because the treatments don't necessarily change. okay? There's an adage in medicine that if it's wet, make it dry, and if it's dry, make it wet. It generally does okay. Now, I'm sure, once again, if somebody has gone to the extent of doing extensive allergy testing on you, they've gone pretty far. I'm sure initially they thought, since it was accompanied by pain, they thought it might be shingles. Is that correct?
Yes, I did.
Okay. And that's obviously something you want to check out. Now, it'd be odd if you'd have shingles just continuously all the time unless there was something.
It's not shingles. They've proven to me it's not shingles.
Yeah, and I believe that. And your history doesn't really comply with that. I assume they ran viral titers and tick titers and did all that kind of stuff. Is that correct?
Honey, they've done everything,
Okay.
except turn my skin wrong side out.
Okay. Well, the fact that the Doxepin works is interesting. I would assume that you've been on lots of antihistamines, and they give you a little steroid shot, and they call it kind of a temporary hives type reaction or an immunologic reaction. I can tell
Give me
you.
one shot they call a blowout shot, and that I can't take another one for 3 months.
Okay, yeah, that's a steroid shot. That's a mixture of a long and an intermediate acting steroid. And the reason you cannot get those very often is a couple reasons. Number one, that steroid, when they put it in your hip, it degrades the tissue around it a little bit. And if you keep putting them in there, you're going to end up with a big hole in your hip, theoretically. You rarely see that, but it can happen. And number two is you're exposing your body to long-acting steroids. And your adrenal glands, okay, on the tops of your kidneys that make a lot of these steroids, if they sense that there's normal steroids already in your body from somewhere else, they want to stop working as hard. And sometimes when they stop working, they don't want to restart. And that's a problem. Okay, so we try to limit our exposure to steroids as much as we can, or put distance between them, and that's why they're doing that. It's not to make things tough on you. It's because they're looking out for your long-term benefit.
And the steroids drive me so mentally crazy.
Do
I
they?
cannot handle them. I'm just like, it's like Jekyll and Hyde. I'm on the steroids. You might as well just go ahead and bury me.
And that's not unusual. You will see that sometimes. A lot of people like the effect. They say it gives them energy. I'm similar to you. They make me feel jittery and not myself, and they can make you feel a little aggressive. You're kind of mean.
Want to slap somebody, and
Yeah.
I'm not that kind of.
Well,
I'm
I know.
5 years old, a very gentle soul, but you put me on those things.
I know.
I'm Muhammad Ali.
Well, next time you're in a bad mood, you tell everybody you're on steroids, and they'll understand.
Yeah.
Okay.
Roid rage.
That's right. That's right. But without seeing it, it's really hard to tell you. Did they ever scrape any of the rash at all, dear, and send that off?
No,
Okay.
that's one thing they haven't done.
Now, and that's another avenue. I guess I would look at it like this. If you told me your exact story that you portrayed to this point, I would say, well, the good part is it only lasts for a day at a time. That makes me feel pretty good, okay? Because a deep-seated rash that's just getting worse and worse over a 6 to 8 month period, that would concern me a little bit. So that makes me feel a little bit better. It sounds like you're fairly well controlled on the medications. Let me ask you this: do you feel like you have some anxiety associated with it at all?
No, and they thought maybe at one time it was that, so
Yeah.
they even put me on an antidepressant or something to help me. And that didn't do anything. That just made me worse. And I couldn't understand that.
Well, once again, as I was kind of saying earlier, on rashes, you do the simple things. You give them an antihistamine, and you give them a little bit of steroid, and that solves 75, 80% of the problems. When that doesn't work, you start looking at other things. Are they on a new medication? Have they been exposed to something allergic-wise? When that doesn't work, then you start think, well, is there an underlying disorder? A long-range immunologic or an inability to fight off certain problems? Or is it anxiety accounts for a lot of topical rashes that come and go very quickly? And so we look at that. So tossing an antidepressant at that is not a bad idea. I know it seems a little flippant, and it seems like docs just kind of throwing the kitchen sink at you and just hoping it works. But sometimes those things do work. All right, and so their thought process makes a little bit of sense to me. It does. Hang in there. It sounds like you're doing everything you can. I can't give you a specific answer without actually seeing it, but it sounds like they've exhausted the normal avenues. So I feel
They just took blood tests again,
Okay.
and all my blood tests came white point. Everything came back so good. He said, I don't know what to tell you. He said, everything looks so good. I don't know where to go, and I'm going, okay,
Well-
I don't need to help somebody.
well, as long as it's not giving you a fever, okay,
Yeah.
or making you sicker, I generally feel pretty good about that kind of stuff. It may be that you need to be on a longer acting antihistamine every day, okay, and that may be something you may want to bring up to your doc, just a daily antihistamine, just to kind of knock down your allergic response just a tad. But I appreciate you
By
calling.
the way,
Yeah.
Family Physicians Care, I love that. I love them. They're always so gentle and kind with me, and just really try to work with me. And one day I had fell through a floor, and they came out and got me in the parking lot and took me, and they were just so good to me, and I appreciate them down there. So
Now, which location did you go to?
over behind Red Robin on.
Okay, yep. Yes, Physicians Quality Care in Jackson. Yep. Oh yeah. If you we scan the parking lot every day. So, yeah, we don't we're not one of these clinics where the minute you leave the door, you're not our problem anymore. No, we want you we want to do everything we can to make it as easy interaction for you. You
Sent me a thank you card. I said, I'm the one that should be sending you a thank you card.
Well, I appreciate the kind words. You come by and see us anytime you want, okay, dear?
All right. Thank
All
you.
right,
And
you
I
take
appreciate y'all.
All righty.
Bye-bye.
Goodbye.
Have you ever had a case of acute hives?
I have not, but I've seen some recently.
I have. I mean, it can really drive you up the wall.
Okay. How does a cardiologist get hives? I mean, is that...
Well, this
do you
is
get
what I was-
nervous when you're trying to pick between a plane and a boat?
I'm glad we've got this visual point here now, because they can see through all this BS I'm having to put up with here. Okay.
Let's go back to the phone lines. Hey, good morning. You're on the air with the docs.
Yes, I'm calling about my husband.
Okay.
He has had this pain in his lower stomach on the left side, like right above his hip. And the doctor can't seem to figure out what it is. He sent him to have a colonoscopy, and they did that. They told him everything was perfectly fine with that. They sent him to do, and I believe they did I don't know if it was a CAT scan or an MRI. I believe it was a CAT scan. And they still couldn't figure out what was wrong with him. And he's wondering if it could possibly maybe be diverticulitis or something like that.
Okay. That's a great question. And I'm sorry, what is your name, dear?
Sandy?
All right, Sandy. This is Dr. Gardner, Peter Gardner. Well, here's the thing, okay? The good thing about left lower quadrant or left quadrant pain in the abdomen is there's not a whole lot of stuff over there, okay? So I kind of like that, because when you start talking about the right side, there's some stuff over there that worries docs, mainly gallbladder and appendix in particular.
Well, it's on the left side.
Correct. So that part is good. Now, let me just tell you, is he having pain, or is he having diarrhea, constipation? What are the associated symptoms?
No, it's just pain.
Okay.
Real pain. Now, let me tell you this, too. Now, for almost 30 years, he has been an insurance salesman, so every day, I don't know how many times a day, he gets in and out of this truck.
Correct.
Now,
Correct.
Would that have...
Yep. Well, I mean, here's the thing, because you want to look at those factors, and I like the way you're thinking. Does the pain come and go? Is it?
No, it's there constantly. Sometimes it hurts worse than others. He said sometimes it's just a dull pain, and at other times it's the sharp pain.
Okay. Well, your doc, the workup has been appropriate. Number, what would be the first thing that I would do? I may look at a little blood work, okay, just to make sure his white count and everything, if he's been running a fever, isn't elevated, because you mentioned the word diverticulitis, okay?
Right.
And what is diverticulitis? Diverticulitis is when the diverticuli get infected. It starts with diverticulosis. Diverticulosis is when you get these little finger-like projections that shoot out from the edges of the colon. And a lot of people think it's genetic. There's a component there. And a lot of people think it's related to increased pressure intraluminally on the colon, which causes these kind of projections to kind of scoot out. And the problem is that they'll get a little bit, every now and then they'll get infected. And then it goes from diverticulosis to diverticulitis. And it's a bad infection. And a lot of times when they get infected, they'll rupture. And if your colon ruptures, obviously that spews colonic contents into your abdomen, and you can get what's called a peritonitis. You can get a very bad intra-abdominal infection, and people die from that. So it's a serious thing, okay? Now, the thing is that they, by your history, they performed a CT. Now, CTs don't pick up everything, but man, they'll pick up diverticulosis pretty good. Okay, so I feel pretty decent about that. Plus, they did the one test that you can't lie about, and that's a colonoscopy. That's a big tube with a camera on the end of it, and must have, even though people like to say video doesn't show everything, medically it does show a lot of stuff. Okay, so I feel pretty good about that. I think you could probably safely take diverticulosis or diverticulitis off the table. Okay.
Right.
Now, what I would worry about is there maybe, what would be some other reasons why you may be having some problems down there? Just increased spasms, or maybe there's a vascular problem. Every now and then, okay, what happens is particularly if the pain is constant,
it's been going on for somewhere between 9 months to a year.
The blood vessels that feed the area, okay, can every now and then get blocked, and when you eat something, or when that part of your colon needs to work more, there's more of an oxygen demand, and it gets compromised if it's not getting the right blood supply. Okay, and that can lead to a situation we call ischemic bowel, and that's a very serious thing. So I bet that is where your doctor is going to look next, to the vascular supply to the colon, because otherwise it sounds pretty darn good. Okay, and I like the way you were thinking once again as far as the musculoskeletal, because you can't rule that out as well. And by that, he gets in and out of a truck. He's been doing it for 30 years, so I know he's not a 30-year-old. Okay, he's been on the planet for a little while, getting some aches and pains, and that can certainly cause it. That's usually more in the back, more than the front, but you can get an abdominal strain, and the problem there is that it's hard to give those muscles a rest because you use them all throughout the day, so they can be a little bit nagging. I like the idea of working up, maybe, like I said, maybe a vascular component there.
Right.
Is he fairly regular in his bowel movements?
Yes, he does. Yes.
Okay. All right. So you guys are really good about getting the fiber and doing all that kind of stuff?
Right.
All right.
Right.
All right. When are you scheduled to see your doctor again?
Well, he isn't.
Okay.
When he did the colonoscopy, he went back to the doctor, and they told him, well, you're okay. We couldn't find anything, so everything,
Okay.
And they left it that way.
Okay.
So.
Now, the GI doctor, is that who he's seeing now, or just his family practice physician?
Family practice.
Okay. Yeah, I know it's frustrating for everybody, because let me tell you, as a doc, sometimes you breathe a sigh of relief, and it's sad when you actually see something, but, the hope is that you don't see anything, but it can be frustrating to the patient. But I like the way they've done the workup. Like I said, a colonoscopy and a CT, that's fairly extensive, okay? Does he have any heart disease at all, or any other
not that I know
peripheral vascular disease at all? Okay.
It's been several years ago. He had the, I forgot what it's called. It was the stress test, but it was the one where they give you the stuff.
Sure. Okay. The chemical stress. Okay.
Yes.
All right. And how'd that turn out?
It was great.
Okay.
Turned
wonderful.
out perfectly fine.
And the reason I'm asking that is because it's heart disease and vascular disease does not discriminate. Okay, if you got it in one area, you might have it in others. So if he has a history of some heart blockage, he's probably maybe developing some blockage in some other areas. Okay.
It was the nuclear.
Okay, exactly, and that's a very accurate test, very good test.
Now, would it make any difference that that's been several years? go?
It would. Dr. Gerard, how good is a normal stress test generally good for?
Oh, I would say, depending on the symptoms.
Correct.
But with no symptoms, I'd say about 4 years.
4 years? Okay.
4 years.
And that's the general thinking out there. Some will go as low as 2.5 and then go out to 4. So, yeah, because I'll get patients all the time say, well, I had a normal stress test and it's 6 years ago. I'm like, well, guys, that doesn't really buy us a whole lot. I mean, it's a lot of changes in that time period. Dear, I'm sorry I don't have the greatest answer for you. It sounds, other than I can give you a little peace of mind, that workup has been very good, because the main things you want to rule out, doggone it, let's make sure there's not an extension of diverticular disease, and let's certainly make sure there's not a mass or something in there. And it sounds like they've ruled that out completely. At this point, what they probably will just the avenue they'll try to proceed is probably just symptomatic relief. Do they have any medications just to help the spasms and those kind of things?
No.
Okay. Yeah. That would probably be where I would probably go next. And you may want to ask your family physician, hey, look, is there any medicine? We know there's nothing in there. Is there any medicine that might just make him feel better to where he's not miserable? And there are some medications that you can use as last resort, and it's not a bad thing.
All right.
Okay.
So, and you said, would you have them to look at the blood flow through there?
You certainly can. You can say, hey, look, I've been reading and talking to some other people about it's called ischemic disorders, okay? The blood supply to the colon, could that be compromised, okay?
Okay.
Because that could be episodic, where there's a low-level pain that doesn't really go away, but then the pain gets worse and then gets better, gets worse and gets better, but never completely goes away. You can see that a lot, particularly as you get a little bit older, okay? And that may be the next avenue to pursue, okay?
All right. Okay,
Hey,
well, thank you so
dear.
much.
All right, Sandy, you take care, okay?
Okay, you too. And I like this show, and I love physician quality care.
All right, we need to put you on a commercial. You're wonderful. Excellent.
Right.
All right, dear.
Good day.
Well, what an excellent discussion of the differential diagnosis of left lower quadrant problems.
Well, we try to.
Yeah, that's a couple of great questions.
Yeah,
this
they
morning.
are. They're very good ones. Because let me tell you, left lower quadrant pain is something. I say you can have a lot more problems with right lower quadrant pain, but it's also a lot easier, because somebody comes in with right lower quadrant pain, I've got to send them. They've got to get a CT. Left lower quadrant pain, you got to use your noodle a little bit more. Okay, you got to kind of think it through just a tad more. And the first patient, rashes. Hey, I tell you, they're the dilemma of every family practice doc. I mean, I try to stay up on it, but there's a reason these dermatology guys do 4 years of nothing but skin. I'd like to think they're learning something I don't know. I mean, I'd like to think that.
Yeah.
So go from there. But no, it's been a good show, and I like the camera. We may have to change the position of that thing. I don't know.
Yeah, we were talking about it, maybe putting it over here somewhere.
Well, I mean, I hate the way
mounted up
Dr.
there.
Gerard. I can see the. Like I said, Dr. Gerard's kind of getting phased out and blocked by the microphone, and
they see my best side.
I know.
So,
well, I mean, it's
that's
I mean, Dr. Gerard's pretty mug needs to be on the air.
that's right.
Get viewership up, particularly in Finger, Tennessee. Excellent.
They have internet and finger.
They do.
Yes.
They do. Well, once again, like I said, the name of the show is It's Your Health. It's every Tuesday morning from 9 to 9:30. And there's been talk we may go back to the original hour version. I kind of like to do that now that we're streaming on video.
Yeah.
That would kind of add to that. That would be nice.
Cool.
And as winter comes up, people get more medical problems. They want to talk about more medical issues. They're not outside doing a million other things. And like I said, there's a lot more things to bring up. And we can start turning this into more educational. By that, we can come in with a topic and start discussing some treatment options, just some real common things.
Right.
And next week, we're going to bring back trivia. So
All right.
put on your thinking caps. I know we're gonna bring back trivia, and we're gonna try to bring back the original prizes where we used to bring the tote sacks, and those kind of things. I really like those.
Yes.
And clients really liked them, so we're gonna bring those back as well.
And I will remind everyone that if you are not on where you can pull up and watch the live stream, it is archived. So folks who are listening in their car or at work or somewhere like that, go to our website, gracebroadcasting.com, and click on the Good News 93.1 Facebook link. And when you do that, the video will automatically come up. It'll be archived. You can play it back and watch it anytime you want to.
Can you get the one from last week?
Yes. Yeah, the one from last week is on there. They're archived. And our Power and Prayer broadcast on Tuesday, we video stream it, and it's archived on there as well. So all of our specialty shows we'll be doing this way.
Wonderful.
I hope they will let us have more time, because I have a lot of topics, that are burning to tell people about it.
Absolutely.
He always does. Once again, it looks like we're kind of out of time. So once again, the name of the show is It's Your Health. Come listen to us next Tuesday from 9 to 9:30. Once again, come see us. Be a part of our medical family at Physicians Quality Care. 7 days a week, 7 a.m. to 11 p.m. Take care and God bless.
Here's the way to feel better, and the best way to look good too. Come and get in shape with us. It's the best thing that you can do. Health and fitness for our generation. Boomers Executive Fitness.
You've been listening to It's Your Health with your host, Dr. Peter Gardner and Dr. Clifford Gerard, presented by Boomers Executive Fitness and Physicians Quality Care in Jackson. Tune in next Tuesday morning at 9 o'clock for It's Your Health, right here on Good News 93.1.
Health